All right, well, your overall health often starts with your hygiene health, and that's why investing in the best oral care is so important. Over at Greeley Dental Care, they offer a wide range of dentistry services. Today, we're chatting with Dr. Taher Dhoon about their clinic and diving into obstructive sleep disorder in kids and how they can help. And Doc, thanks for coming in. It's nice to meet you.
Appreciate you
Welcome
having me.
to the show.
Yeah, thanks so much.
So this is a fascinating topic that you guys tackle in the Greeley at your business. Tell me more about this obstructive sleep disorder in kids.
Yeah, so I mean, I've grown up with this my entire life.
Did you really?
My father, he would, rumble the room next to us, and if we're at a hotel, like no one can sleep but him. And then he actually ended up having his first heart attack when I got dropped off at dental school. He had a stroke shortly thereafter. And then we got him tested and we found out, okay, well, sleep apnea is a condition. And then I started getting into it, started treating patients in my own practice. And then I test myself. And I have sleep apnea. So I don't have mild or severe, I have moderate sleep apnea. And so I actually get to treat myself. And then as I went further down the rabbit hole, I started to look at children and see the signs and symptoms in children. And now we're actually treating children, and we're fixing a whole generation of patients who might be adults with sleep apnea, and we're able to really prevent it in a childhood age.
And you said it's best to treat when they're young because it's, what is it, harder when they get older?
Yeah, so when you're our age, you're done with growth and development, everything is fused, all the bones are fused. With kids, I mean, they're still growing. So if we can control how they grow, and we can control it via like orthodontic appliances and expanders, we can actually improve the nasal passageways, we can improve the oral passageways, and we can get them adequate oxygen at a very young age. So then they would never need a CPAP when they're older, because we're taking care of it when they're kids.
So they're actually cutting off oxygen supply, right? Is that what's happening?
Yeah, so you have two airways that go in. One that goes in through the nose, one that goes through the mouth, and there's two tubes that connect into one and then go into the trachea, into the lungs, and just perfuse the body. So at night, back here behind the tongue is where it pinches off. And so if we can help open that up, if we can create enough space in that region, the patients are going to get adequate oxygen. And with kids, it's actually linked to intelligence, it's linked to ADHD. I mean, for those of us who have children, we know what a tired kid looks like. Like when I'm tired, I'm not myself. And when my kids are tired, they are 100% not themselves. And so if we can fix it when they're really young, I mean, not only can it help them with their intelligence and growth and development and all those things, but it helps with their behavior and how they show up on a day-to-day basis. So
this is really important. And we're watching your video here from your business, Greeley Dental Care. What kind of appliances, what type of interventions are we talking about here?
So for kids, it is so easy. It is so easy. And that's why I'm really passionate about it, is because we can really bring this access to care to so many patients, where for adults, it's surgery sometimes. And for the kiddos, it's just a simple mouth piece that they have to eat or wear at night. So that blue appliance right there, if they wear that every single night, that is going to help with the growth and development of the jaws. It's going to help with the position of the tongue, and it's going to help open the airway. And then when they get to a certain age, then we just put physical expanders in there, just like an orthodontic appliance, and we just open it up ever so slightly.
Yeah. So as a dentist, can you instantly spot, based on the structure and what you're seeing, that this is going to be an issue?
Yeah. Nowadays, if you asked me this 10 years ago, maybe not, but if you ask me now, I walk into the room, I can see the bags under the eyes.
Oh, really? So you're already analyzing when you walk in?
Yeah, or you see like a really narrow face, or if you see a kiddo whose just mouth is open and they're breathing through their mouth only and not through their nose. These are instant signs that they may have a condition. And then when we do the measurements and the scans and the testing, then we get confirmation of what I'm already thinking.
Yeah. What advice, Doc, would you give parents who suspect this might be an issue?
I would say, number one, just start documenting things. If a parent comes in and they have notes and dates and times and like, hey, this is what happened and my kiddo was wetting the bed, they went to sleep late this night, or they just wet the bed 3 times a week, they come in, or that, hey, the school called and we had a behavioral issue at school. If they bring any of this information to me, it just helps me put the pieces together. Just consider me a detective who happens to be a dentist. They bring in all this information, I fit all the pieces of the puzzle together, and then we come up with an adequate, plan for them.
How are you sleeping these days?
Sleeping better than I ever have.
I love that this is such a personal thing for you, because that way your passion comes through in everything that you do. So Doc, thanks for coming in here. here
Yeah.
today and sharing all this information. Here's some more. You can call Greeley Dental Care today and schedule a free sleep test and consultation for your child. You can give them a call at 970-352-4242 or visit them online at greeleydentalcare.com. Thanks to Dr. Dhoon for stopping by GDC, and a big thanks to Greeley Dental Care for sponsoring this segment.